Okay, so just what is schizophrenia? Schizophrenia is a mental disorder characterised by a breakdown in thinking and poor emotional responses. It's one of the most severe and debilitating forms of psychosis, which is described as a split from reality. Common symptoms include delusions, hallucinations, disorganised speech, and catatonic behaviour. These can be grouped into positive and negative symptoms. Positive symptoms such as extreme paranoia and hearing voices are examples which are present in schizophrenia sufferers, but not in the normal population. If you like, they've been added on by the illness. Negative symptoms such as a lack of emotion and a lack of motivation are seen as deficits from normal behaviour. If you ask a random person on the street what schizophrenia is, a large portion of the time they will say something along the lines of, "It's when someone has two personalities inside their head." This is wrong and has often been portrayed incorrectly in films and the media ever since it was recognised over 100 years ago. This common misconception is founded by the idea that schizophrenia roughly translates from the Greek as split mind. The meaning should be interpreted as the mind is split from reality and not as the mind being split into multiple personalities. Someone with more than one personality has multiple personality disorder, and this is very distinct from schizophrenia. In the UK, around 0.5 to 1% of the population has schizophrenia. The severity varies from person to person. This severity largely depends upon the frequency in which the sufferer has full-blown psychotic episodes and the nature of them. Some schizophrenics only have one psychotic episode, while others have them regularly across their whole lifetime. The effects can be devastating both to the individual with the disorder and those around them. Some of the possible effects are problems with forming relationships, prevention of employment of daily activities due to social difficulties and the complexity in carrying out simple tasks, alcohol and drug abuse, and increased suicide rates. A 2007 study in the Journal of Health Policy and Economics estimated the total societal cost of schizophrenia in the UK for 2004 was £6.7 billion. So, perhaps the most interesting question of all, what causes schizophrenia? The public and media have a habit of thinking unilaterally when talking about the causes of mental illnesses. When explaining the causes of mental illnesses, we can take a biological or psychological approach. Genetic research found that schizophrenia is thought to have a heritability of around 80%. The most successful studies have used twins and have shown that there isn't one causal gene, but multiple genes thought to increase susceptibility. Research into the neurochemistry of schizophrenics has led to the dopamine hypothesis, which links the neurotransmitter dopamine to psychotic symptoms due to the greater number or sensitivity of dopamine receptors in the brain. However, a biological explanation alone fails to explain the variations in symptoms of schizophrenia between sufferers. Cognitive approaches attempt to explain symptoms such as disorganised thinking, which is expressed as a difficulty paying attention to relevant information, not forming relative associations, or over-attention to irrelevant information. Although each explanation accurately explains an aspect of schizophrenia, neither tells us the full story. This led psychologists to propose the diathesis stress model, which means having a biological predisposition towards a disorder which we develop when psychological risk factors are encountered by the individual. In the example here, imagine two twins are born with the same genes and so have the same susceptibility to schizophrenia. Now imagine they are both brought up in separate environments. One environment may contain more risk factors such as stress, drugs and alcohol, and the mother-child relationship in the brain development stages. The result is that one twin forms schizophrenia and the other does not. Finding out the causes is important for a number of reasons. Firstly, for prevention. In the future, we may be able to tell who is genetically predisposed and know exactly what the risk factors are. Therefore, steps could be taken for the predisposed to avoid these environmental catalysts. Secondly, for treatment. Understanding the condition has led to the antipsychotic drugs and cognitive behaviour therapy used to treat schizophrenia today. Also, and finally, now we know how schizophrenia is caused, we should be less judgmental about sufferers and look out for those experiencing risk factors so society can help them when necessary. For more information, click the links to the British Psychological Society and the NHS.